Everybody, welcome to Liberty in EDC. We are here with Nancy Williams, who is our public health officer here in El Dorado County. So we're going to be asking her about the state of El Dorado County with the coronavirus right now. So, hi Nancy.
Hi, how are you?
Good, how are you doing?
Good, thank you.
Thank you so much for doing the show and being willing to come on this video interview with us and everything.
It's a pleasure.
Let's just jump right into it. Or actually, real quick, just tell us a little bit about, yourself. Like what does the public health officer do for El Dorado County?
Yeah, so my position as county health officer, I'm one of 61 health officers in the state of California. There's one for each county, and 3 cities additionally have their own health officers, meaning they have their own health departments. And I both lead the health department, and I also serve as kind of the legally responsible person for the health in our county. So that can involve sometimes writing orders for policies and that sort of thing. But most of the work I do relates more to guidance and communication with the state and other counties, so that we can work together toward the improvement of health in the population of the whole state.
Okay, great. So as far as the coronavirus goes, what's kind of the state of El Dorado County right now?
Well, we're keeping counts of our newly diagnosed cases. That's for anybody who has a positive test result on a daily basis. And we're actually posting those on our county website, which can be found through the COVID-19 link on edc.gov.us. And as of yesterday afternoon, the total count of cases that we've had so far is 35. And of those, we've keep track of people after they've become ill and follow them until they're well again. And 25 of those people have fully recovered by now. And we've had 0 deaths.
Very, very good. Is that including Tahoe as well with the western slope?
Yes, it includes the whole county, both all the way from Tahoe down to El Dorado Hills.
So that's good news. We haven't had too many cases, right, for our population.
And we think that that's a result of the stay-at-home order that was issued by the governor. That's actually working pretty well.
Awesome. Now, there has been some talk about the virus already being in California, since December or January. Do you think it's possible that the virus has already moved through California, and that's why we're not seeing too many cases right now?
I think that's pretty unlikely. There hasn't really been widely spread antibody testing. I'm not aware of any antibody testing has happened in our county yet, but very little has happened anywhere. We know that some of the early cases happened down in the Bay Area because there's a lot more travel of people between there and China, and some people had been in Wuhan and other places that had very early illness, and of course brought it unknowingly back to California. And the cases there have been higher in count, of course, than we've had here, but there really hasn't been a lot of drift past the metropolitan areas into the more rural areas like ours so far. And I also believe that if we had more cases, we know that children are more likely to be asymptomatic or have very mild illness that might have gone missed. And of course, they wouldn't have qualified for testing if they weren't very ill either. However, we think that would have spilled more into other household members and adults, and we would be seeing it in our older population a lot more than we are. So I'm pretty confident that we really have had very little COVID in our county so far.
Great. Now, what's the state of testing? I mean, can pretty much anybody go to the hospital and get tested, or like where are we at right now with that?
Not yet. So the gatekeepers for testing are still people's primary care doctors. So unless they're sick enough to go to the hospital, so somebody's really having serious problems breathing of stuff or something that would make them go to the hospital, normally, of course, they should seek that level of care. But their regular providers can help screen them to determine whether testing makes sense or not. There still is a shortage of tests throughout the country and in California, and of course in our county as well. Our 2 hospitals and the community health centers and others have the capability of sending test specimens off to commercial laboratories, and that's still happening. And so the people who really need to be tested are getting tested still.
And what about like other supplies? Like it sounds like we don't have too many cases. So how's our hospital doing here in El Dorado County?
The hospitals are both in pretty good shape. As far as numbers go, you'd have to talk to them directly to find that out. But what I've heard most recently is that their bed counts are down below normal, and that's because most of the optional or elective cases or things that could be postponed have been canceled or postponed, and so they're doing really well as far as being able to keep up with the demand they have right now.
Very good. That's awesome to hear.
Mm-hmm.
For El Dorado County, is there anything specific or different about our county that people should be aware of compared to what they're putting out statewide or nationwide as far as information goes?
Right. So that's a great question because we do have a pretty interesting and different county. We're a large part of us geographically is rural. And I think that gives us some benefit as far as just people naturally being spaced apart and maybe not intermixing as much, which of course creates opportunities for disease spread. And so that's a benefit for us. But we also have higher density population down, say, in El Dorado Hills. And a lot of those people commute to work in Sacramento. Many of them, of course, I'm sure either telecommuting or working from home right now, but there's still more mixing among that population. And then on the eastern side, of course, Lake Tahoe has a lot of, is a vacation destination. And a lot of people in California have second homes there. There are a lot of vacation rentals. There's a big temptation when people are sheltering in place that they thought, well, we could go be safer up at Tahoe, especially if you're coming from somewhere like the Bay Area or another metropolitan area that's crowded. Yeah. It seems like a safe place to be. So we've had a lot of people wanting to be up there. I think Tahoe has actually done pretty well. And the hospital up there, Barton Hospital, was very concerned that a flood of people might come up and inadvertently bring the virus up there and create an outbreak in their community. And I think we've been very lucky that that hasn't happened, because that has happened in a lot of other resort communities around the country. So it was a very real concern. It probably still is a very real concern going forward. But we'll be, I as the health officer will be working hard to prevent that from becoming a problem in the near future.
Yeah. So I know you sent out a there was an order that was put out, telling people, hey, don't go to Tahoe, just to get away and everything. Mm-hmm. Is there anything else that you guys can do to discourage people from just overwhelming, like the small city of Tahoe?
That's a good question. I think it's been relatively effective to have statewide messaging to stay at home and to avoid non-essential travel. I think it was important for that message to come out from the governor and from other counties, not just from us, because of course many people coming to our county are not paying attention to the messaging that's coming from here. I know our public information officer is doing her best to get information to the news outlets down in the Bay Area to let them know, for instance, when I issued that order not to travel to Tahoe for non-essential business. She wanted to make sure that got out there. And I think it did. I think there are always going to be a certain number of people who don't believe that the order is important and won't follow it. But I think the majority of people across the state have been doing a pretty good job at staying home. I know there's a lot less traffic up there than there would have been had we not said anything, or had the governor not said anything.
Yeah.
I think we'd like to do more. At this point, I think it's becoming more and more challenging, because the flatter we make this epidemic curve in the state, the less concerned people are going to be. So that kind of remains to be seen.
I guess the thing that's on everyone's mind right now is probably, okay, when do we get off quarantine? Like, when do we get to go out there? So what role does the county play in, lifting of the quarantine? And like, also, do we have, kind of an idea of how that rollout will look like?
Mm-hmm. Yeah, so the stay-at-home orders right now, or orders or guidelines, are at multiple levels. So the governor made an order for the entire state. So technically, none of us at any state or any county level can make a decision that's any less restrictive than that. We can, of course, increase the restrictions in our specific counties, but we can't make it any less strict than the governor has done. So the governor, I know, is starting to think about, well, what does it look like for us to start lifting the orders? I don't think, and as he mentioned in his press conferences this week, it's not like we're going to turn on a light switch and everything's going back to normal. We know that there have to be some measures that remain in place from now until we get to a point where we have vaccine or otherwise can control this illness to the point where it won't cause great harm to some of the vulnerable people who could get very severe disease right now. So we're not expecting a lot of change, but we've learned a lot in the last several months while we've implemented different measures to help reduce the spread of the illness. And some of the things that, we originally called it social distancing. Now I think we're calling it more physical distancing because we don't want people to feel that they can't be socially connected with others. There's just ways to do it without being physically close and touching one another. And so those things in combination with the restrictions on non-essential work and non-essential travel, we think together have done a good job at flattening the curve as we were hoping to do. The question now is, have we learned enough about some of these distancing measures and the things that reduce the physical transmission of disease, like touching things and breathing into common air, wearing face protection, that sort of thing? Is that possibly enough to prevent the spread of illness to where we could roll back some of the other restrictions? And I feel pretty confident that we're going to be okay going in that direction, but we're going to need a lot more cooperation on things. And I think the new normal may be to be seeing people in public with face coverings on, because that's one of the things that may be a trade-off. You get to drive farther, but you have to protect your face and from breathing on other people and to some extent possibly from them breathing on you.
Yeah.
And I guess I can also mention, as far as timing goes, so we know the governor's already started talking about this, and the health department at the state level has helped the governor put together these 6 points that they want to consider as criteria for the possibility of lifting some of the requirements, one of which is testing, which is not really where we want it to be yet. So that may be something that holds it back a little bit. And then they've also been in communication with all of the health officers across the state. So we're trying to make decisions together jointly with consideration for all different types of counties, the urban ones and the rural ones and ones that have had more cases and have more travelers and ones like ours that are mixed or have tourist areas, that sort of thing. So I'd say those discussions are happening now. The governor said he didn't expect anything really to happen for the next few weeks, and I agree with that, but I think decisions will be made fairly shortly about what the next step is.
Do you know, should we be expecting to see any type of antibody testing rolling out in our county? I know the tests are still kind of, I guess, what's the word? Aren't very good yet, right?
Well, I'm not sure. I don't know what the quality of the antibody testing is, and it could be very good at this point. And there's not a lot of reason to use antibody testing on the whole population, for example, because we really think that the vast majority of people have not been exposed to COVID-19 yet. So they could be tested and you could have 99% of the population is negative on antibodies. And then where are they tomorrow? Well, they might want to be tested again for antibodies later. So you're wasting a lot of testing. So I think antibody testing would be best used at this point for doing a sample of populations to get an idea of what percentage is immune. And you wouldn't have to test the whole population, just kind of a cross section. That gives you an idea what the whole population might be like. And that could be done in multiple parts of the state just to get an idea of the epidemiology of this epidemic, but not necessarily to test individuals. And I've heard, another reason for doing antibody testing might be if you have somebody like a hospital worker, somebody who works in the ICU or the ER or something, who's had an illness, and you may want to, even if they tested positive for COVID and we know they've had it, you might want to learn later, like, did they really build up antibodies, and are they really considered to be immune, so that they could safely go be working and not be concerned that they're going to catch something later or that they might transmit something later. So it might be reserved for the very special small percentage of the population that's really critical to this COVID response.
Right. Yeah, definitely. Now, is there anything else that you want to add that you think, the people of El Dorado County should know right now, or, just stuff they should keep in mind?
I think the biggest thing is that whenever the next phase rolls out, it will be done very thoughtfully. There will be advice on what the population should do as far as protecting one another. And it may involve more travel. It may be difficult to keep people from out of the county from coming into our county, or for people, of course, a lot of the state has attractions that are going to draw people not just from within the state, but also from out of state. Tahoe is obviously the big one for our county, but people want to go to Yosemite, they want to go to Disneyland, they want to go to San Francisco. All of those things at some point are going to happen again. So it's going to be very, very important that whatever other means that we are recommending be done to protect one another continue to happen. Even if we feel that there's not a lot of disease in our county, we may actually need to be stepping up those other measures and taking this really seriously. And if we do a good job at it, I think that is going to either significantly delay the need to resort back to where we are today with the stay-at-home order, or if we do really well and those other measures are working maybe even better than we're thinking they might be working, maybe we don't have to do a stay-at-home order again. So to me, trade-off of having to wear a mask for a year versus having to stay home and not go places, that's a no-brainer. I think people would much rather have a face mask on for a few months than be out of work and have their kids out of school and all the other things that could happen. So it's not going to be easy, but I think I really would hope we get people's buy-in, enthusiasm, and cooperation on it going forward.
Yeah, definitely. Where can people go to find more information and keep up with the most up-to-date info? So
the county's webpage, which is very easy to access, the main page is edc.gov, so edcgov.us. And there's a COVID-19 link on the top. I think it's a scrolling banner, so you have to click over to the right banner if it's not there at the moment. But COVID-19, click on that. That goes to a page. It's got a bunch of links on it you can look up our case counts. You can look up resources, a lot of other information about COVID-19 on that page. And that would be a great place to go.
Great. Thank you so much for coming on, Nancy. I'm sure you guys are really busy over there. Sounds like you guys are doing a great job keeping everything, moving forward, keeping everybody safe. So we really appreciate it.
Okay, thanks. If I can give one big shout out to my communicable disease team, they are doing what they normally do. I know reportable diseases are getting reported all year round, and this COVID-19 has added one huge thing to their plates, and people have worked a lot of hours keeping up. They're going to have a big job ahead of them as they have to continue to track every single person who tests positive. We follow them until they're well. We check out who they've been in contact with and find out if anybody needs to be quarantined for their protection and all that. So they're doing a fantastic job, and they're behind the scenes and not getting enough recognition. And so I want to give them a little shout out right now.
That's great. Yeah. And I'm sure everyone here in the county too says thank you to them as well.
Well, thank you.
All right. Have a good one. Thanks again for coming on.
All right. Thank you.
Are you fire safe? Are you about to lose your homeowner's insurance? Do you have the legally required 100 feet of defensible space? FireSafe Pros can help you comply with the law and insurance company in addition to helping you save your home by providing weed eating, field mowing, shrub removal, vertical clearance for trees, chipping, and hauling.
One of the things we were concerned about was fire safety both to the employees and our business operation. I found FireSafe very easy to work with. The owner's a very honest guy.
Our team is here to help you to be fire safe. For a free estimate, call FireSafe Pros today.